Myasthenia gravis is an autoimmune disorder that affects the individual's skeletal muscles. Antibodies destroy the acetylcholine receptors MuSK and LRP4. About 85% of those who are diagnosed with myasthenia gravis have antibodies, which are made in the thymus, that attack acetylcholine. 10% are MuSK, and less than 5% suffer from antibodies attacking the LRP4. These antibodies include B cells that are meant to fight bacteria and viruses, but instead are attacking the receptors. When these receptors are destroyed, neurotransmitters such as acetylcholine cannot attach to the neuromuscular junction or end plate, and the muscle cannot contract. This causes localized muscle weakness. Myasthenia gravis is characterized by localized muscle weakness that worsens with repeated movements and later in the day when you're tired or stressed. In about 60% of people, the first sign of this disease is known as asymmetric ptosis, when there's drooping of the eyelids on one side of the face, or with variable diplopia. Typical myasthenia gravis is classified as either ocular or generalized. Ocular occurs only when the affected muscles are in the eyes. Generalized will start to affect other muscles throughout the body. This can present in the face with difficulty smiling, unusual facial expressions, and fluctuating speech impairments known as dysarthria. As it progresses to the neck, people will present dysphagia with difficulty chewing and swallowing, choking, gagging, and drooling. Less common muscles in the limbs are affected and typically affect the muscle closest to the body's midline. In addition, weakness of the chest muscles, such as the diaphragm, can cause dyspnea. Life-threatening respiratory failure can also occur in about 10% of individuals whose respiratory muscles are affected, known as myasthenia crisis. When diagnosing myasthenia gravis, first, it is further broken down depending on course type, whether it's ocular or generalized, age of onset, antibody involved, and the pathology of the thymus, which then categorizes by the clinical features as well as the specific therapeutic needs. So first, we start with clinical evaluations. So first, when evaluating, you have the patient look upwards for 1 minute to observe for worsening ptosis. Then, you get the patient to stare at an object laterally for 30 to 60 seconds and report double vision if it occurs. Lastly, you ask the patient to complete 5 consecutive resisted shoulder abductions to observe for gradual weakening of the deltoid muscles. This is going to help you determine those previous classifications that were discussed earlier. After a clinical test is done to show general muscle weakness, then electrophysiologic and serologic testing is going to be done by a neurologist. Electrophysiology is single fiber electromyography that has the highest sensitivity, and it causes nerve stimulation test that's sensitive and is needed for diagnosis. Then serologic testing is done, and the acetylcholine receptor antibodies are highly specific and positive in about 85% of cases of generalized ocular myasthenia gravis, but only 50% of pure ocular disease. For treatment, there's no cure for this autoimmune disorder. Treatment focuses on eliminating antibodies from circulation or by inhibiting effector mechanisms. Thymectomy is a commonly used surgical procedure that removes the thymus with the intent to eliminate T-cell-induced antibodies. Immunosuppressant drugs, like your MABs, are also used. Intravenous immunoglobulin is a very effective treatment regimen. It consists of immunoglobulins collected from donors and act to destroy and neutralize these antibodies in the bloodstream and block the production of new antibodies. Lastly, plasmapheresis is a treatment used, much like dialysis, but works to remove plasma from the person's blood and replace it with a substitute plasma. The overall goal is to decrease the amount of circulating antibodies. So as a nurse, what is going to be the thing you want to worry about most? Because the patient with myasthenia gravis is usually admitted to the hospital due to respiratory tract infections or acute myasthenic crisis, a lot of the following nursing interventions are aimed at maintaining sufficient respiratory ventilation, continuing drug therapy, and watching for any side effects that may occur. Care should be primarily focused on neurological deficits and their impact on the patient's activities of daily living. First, we look at cholinergic crisis, and it can occur due to taking too much medication, so their medication should be withheld depending. Anticholinergic medication, an antidote, should be administered to reverse symptoms of a cholinergic crisis. The patient should also be provided with ventilatory support because although an anticholinergic medication like atropine may help, it's not always enough. A cholinergic crisis may cause bronchospasms with wheezing, bronchorrhea, respiratory failure, diaphoresis, and cyanosis. On the other side, you could also have myasthenia crisis, which is due to an inadequate dose of medication, so the medication should be increased. The patient should also be provided with ventilatory support if needed due to the respiratory muscles becoming too weak to move air in and out of the lungs. The patient may need ventilatory support until the medication reaches therapeutic levels. Muscle weakness can affect the patient's respiratory system. These patients are prone to respiratory distress and aspiration. It's critical to monitor the patient's oxygen saturation, ensuring it stays at about 92%, assess their ease of breathing and breathing patterns, their skin color, and lung sounds frequently. The nurse should administer oxygen as ordered and make sure there is suction and an ambu bag in the patient's bedside in case of an emergency. Since myasthenia gravis can affect the muscles that enable an individual to chew and swallow, patients should be taught how to achieve a balanced nutrition while choosing foods that can easily be swallowed and chewed. Switching to a temporary soft diet is advisable when dysphagia is symptomatic. Some examples are scrambled eggs, baked and mashed potatoes, and cooked vegetables. If possible, medication administration should be scheduled so that the drug's peak action and its desired level during mealtime. This will make mealtime much easier for the patient. Myasthenia gravis can affect the ocular muscles, causing weakness of the eye muscles, bilateral ptosis, and constant or transient diplopia. This makes patients susceptible to irritation and dryness of the eyes. Therefore, patients should be provided with eye drops and/or an eye patch to prevent discomfort. Generally speaking, the muscle weakness caused by myasthenia gravis can cause other consequences, such as pain from poor posture and sleep disturbances due to sleep apnea syndrome. Therefore, analgesic medications can be effective to manage pain. Since patients often feel fatigued from minimal physical activity, it is also important to provide frequent rest periods. The nurse should also implement diversional activities such as therapeutic approach to support the patient's psychological, emotional, spiritual, social, and physical needs and well-being while taking their mind off of life stressors. Diversional activities help maintain the use of visual and hand skills, give purpose and meaning to life through different activities, and allow clients to work within their own capabilities. Patients should also be taught to recognize their personal triggers that may exacerbate myasthenia gravis. Triggers include stress, drugs, alcohol, infection, or caffeine. Lastly, financial burden is a consequence of this disease. It is estimated to cost individuals with myasthenia gravis about $20,190 a year. So there will be some needed referrals to outside help for that. Thank you for listening, and now let's ask some questions.